Hi, my name's Ed Hope, a junior doctor in the UK, and welcome to Sick Notes, where I explain medical things in simple terms. Now, I've reviewed quite a few medical TV dramas on this channel, but today we're off to the movies. As a huge nerd and a Marvel fan, I thought we'd visit Doctor Strange because it's got lots of cool medical scenes that we can talk about. Now, I know the creators of the film, if they wanted it to be 100% accurate, they probably could do it. So although I may be nitpicking a few things, I understand that they're there to tell the story, so don't get offended if I start picking things up. I'm just going to explain if you wanted to know a little bit more about the medicine. So let's break down the scenes from Doctor Strange. Good hand washing technique going on there. You see how they're letting the water drip from the fingertips down the elbows. Quite a subtle thing, but it's quite important because our hands and fingers, we want to keep as clean as possible. And our hand washing technique is never going to be 100%, so there'll always be some bacteria on the skin. So what you don't want is, if you had all the drips coming down your fingers, you don't want all the bacteria from your forearm and your wrist to be then collecting on your fingers. So you want to keep your hands up like this, so everything is falling away from your hands. It's a small thing, but nicely done. Okay, so we don't tend to put our hand through our sleeves like this. It's more of an old school way of doing things. Nowadays, we tend to keep our hands inside of our sleeves until we put our sterile gloves on top, and then we open up our hands into the gloves so our hands never go out on the edge of the cuff, again to try and keep the hands as clean as possible. It's a really tricky thing to learn how to do though. Oh! We were doing so well here. Yeah, this is not quite how we do things. If someone saw you do this in theatre, they'd ask you to scrub in again because your mask, your hat, and your scrubs underneath are not considered sterile. So you should all put them on first before you start scrubbing in. The reason being, as you can see here, Doctor Strange subtly touches his cheek as he's putting on his mask, essentially making his whole hand washing procedure pointless. So hands up like this, that's exactly how you are in theatre, just because you don't want to be accidentally brushing anything and de-sterilising your gloves. You may think, why am I being so picky about these little touches here? Well, to a doctor, they stand out really obviously because infections in surgery are a major complication. Funky music in theatre, believe it or not, pretty realistic. It usually depends on the lead surgeon and what their musical tastes are, and sometimes when they're at a real crucial bit in the surgery, they'll ask all the music to be off and everyone to be very quiet. And sometimes in operations where the patient's awake, like cesarean sections and things like that, the patient is allowed to choose the music as well.
Oh, I got this, Stephen. You've done your bit. Go ahead, a little closer.
What is it?
GSW.
Amazing, kept him alive.
GSW, gunshot wound, you probably knew that one already.
Apnea failed the brainstem test and the apnea reflex test. I think I found the problem, Dr. Palmer. He left a bullet in his head.
Thanks. It's impinging on the medulla. I needed a specialist. Nick diagnosed brain death. Something about that doesn't feel right to me.
We have to run.
Okay, so this patient has a bullet in the medulla and is now apneic. So that's the term we use when someone stops breathing. I think what Doctor Strange is getting at is the medulla is part of the brain stem, so in between the brain and the spinal cord. And it's where all our involuntary centers are controlled from. So our like breathing, our heart rate, our digestion and things like that. So I think he's thinking that the bullet is pressing on the medulla and therefore stopping the patient from breathing. So if he removes it, then the patient may be able to breathe for themselves again.
Organ harvest, he's a donor.
Slow down. I did not agree to that.
I don't need you to. We've already called brain death.
Prematurely. We need to get him prepped for suboccipital craniotomy.
Not gonna let you operate on a dead man.
So they're going to prep the patient for a suboccipital craniotomy. Now, a lot of people ask, how do you remember kind of all these medical terms? Well, often you can break them down. So let me describe what this means. So here's your skull. It's actually made up of 8 cranial bones, so all this domey bit around here, and 14 facial bones, as we can sort of see here, that are all fused together, with the exception of the mandible, your jawbone here. I think the springs need oiling. I won't name all the bones, but this bone at the back, we can see here, it's called the occipital bone, and you can feel that in your cells by feeling that bony ridge right at the back lower part of your skull. And now we know the bone we're talking about, suboccipital, means low down or underneath, just like submarine means something that's underwater. And they then say craniotomy. So the cranium is the domed bony part of the skull that we mentioned earlier, and otomy means to make a hole. Therefore, a suboccipital craniotomy is where we make a hole in the lower part of the occipital bone. In this case, to get access to the medulla to remove the bullet.
Perfect bullet. It's been hardened. You harden a bullet by alloying lead with antimony, toxic metal. And that's leached directly into the cerebral spinal fluid.
Rapid onset central nervous system shutdown.
We gotta go.
The patient's not dead, but he is dying. Still want to harvest his organs.
Okay, so it's less the fact that the bullet is sort of pressing on the medulla, it's more like the lead in the bullet is creating a poison that is stopping the brain from working. So that kind of checks out. I mean, it's probably pretty far-fetched that a bullet could get in that and then cause those problems. You know, you'd think it more so would be the bullet causing bleeding and other damage like that. It's a bit far-fetched, but you know what? We're dealing with wizards and sorcerers, so you've got to let a few things fly.
Thank you. Image guidance stat.
We don't have time for that.
You can't do it freehand.
So Dr. Palmer talks about image guidance, so that's where we use previous scans, be it CT or MRI scans, to guide the surgery. So this is super important because we want to limit the amount of normal tissue that we damage as we go in. However, it takes time to configure because you need to set up all these scans to map to the sort of fixed points of the skull. So it's generally used in elective procedures, you know, planned procedures. Whereas here, they don't have time to do that because they think the patient's dying. So Dr. Strange is going to go in freehand. So we see a much more basic form of imaging being used here called fluoroscopy. So that's where we have a X-ray device. That's what that big round cannon type thing was, that allows us to give an image of what the doctor is looking at. The difficulty is it's obviously just a 2D image, so it's really difficult to judge exactly where the instruments are. It also, because it uses X-rays, everyone in the room has to wear these kind of heavy lead aprons just to stop you from the long-term damage from X-ray radiation. Nice work. So anyone that's seen my video of me playing Operation would realise that I wouldn't be too good at doing that. I like the fact they just didn't show them walking off the shocks. A lot of times when you see theatre procedures in medical shows, they feel like as soon as the bullet's out and things like that, then the operation's over. That bullet would have caused loads of damage going in, so there's still quite a bit of work to do in this theatre case. The reluctant hug. Always embrace the hug. Yeah, I mean, most of us drive Lamborghinis, sure.
Billy, what do you got for me?
I've got a 35-year-old Air Force colonel, crushed his lower spine in some kind of experimental armor, mid-thoracic burst fracture.
Okay, so Billy's called, he's got a mid-thoracic burst fracture. Now the spinal cord is inside the spine. It's kept safe within the vertebral column. The vertebral column is broadly made up of 4 types of vertebra. Let me show you on the skeleton. It just doesn't look right without the head on. So in the neck we have 7 cervical vertebrae here. In the chest we have 12 thoracic vertebrae. They're the ones with ribs coming off. Then we have in the lower back the lumbar vertebra, there's 5 of them. Then we have our sacrum and our coccyx, the sort of remnants of our tail. Billy mentions a mid-thoracic burst fracture, and so we know it's in the thoracic region because we say mid and we know there's 12 of them. He's probably talking about vertebra 5, 6 or 7, so around about here. Finally, a burst fracture. So a fracture is a term we use for any broken bone, and a burst fracture is when the bone's been compressed and literally burst into lots of different pieces. And you can see the large vertebral bits here, that will get compressed and actually just burst. And these can be particularly unstable because this bone gives stability to the spine, so it generally needs surgery to fix.
I have a 68-year-old female with an advanced brainstem glioma.
Yeah, you want me to screw up my perfect record? Definitely not.
So advanced brainstem glioma, sadly not a good thing to have. A glioma is a type of brain cancer. So the way we categorize any cancer is the type of cell that has turned cancerous. So in this example, the glial cells are the ones that are part of the connective tissue cells of the brain. And that's why an advanced one can be really nasty, because the connective tissue goes all through the brain. And if you're trying to take a tumour like that out, it's difficult to know where the tumour ends and where the normal tissue starts.
How about a 22-year-old female with an electronic implant in her brain to control schizophrenia struck by lightning?
That does sound interesting.
I see that all the time, electronic implants being struck by lightning. I don't know what he's on about. I wouldn't know what to say about this one, but I have seen a few electric shocks before. Generally, if it doesn't kill you immediately from putting your heart into a funny rhythm, then most people do absolutely fine after them.
Got it.
Using your phone while driving. This public health announcement is brought to you by Dr. Strange and Dr. Hope. Don't do it.
11 stainless steel pins in the bones. Multiple torn ligaments. Severe nerve damage in both hands. You were on the table for 11 hours.
Operations lasting 11 hours. I've been in them before. She's kind of focusing a lot on his hands. Obviously, that's the whole story, isn't it? And that's the kind of visual thing that he's a surgeon. But he's blooming lucky to not have sustained any kind of injury to his head or chest or abdomen or pelvis or anything like that. I mean, you know, in a weird way, our hands are kind of appendages we don't really need. They're just optional extras. It's lucky he survived by not getting injured elsewhere. Unlike the cells in your brain, your peripheral nerves do have an ability to regenerate, although it's very difficult to grow back in the exact same way, so people can be left with chronic pain syndromes and functional problems. And we see a lot about the rehab here, which is a really nice, real touch to everything that's going on. I'm glad that they got this bit so right, because it's such a difficult part of it. You feel like just getting through the original injury, everyone should be lucky now, but so much of the rehab takes so much mental strength and physical strength, and you see all the people involved here, so nurses, physios, occupational therapists, the doctors are just at that initial bit. All the work is done by other healthcare professionals and the patient and their friends and family too. So we fast forward into Doctor Strange's sorcerer training, and in trying to defend one of the sanctums, he gets stabbed and ends up seeking out Dr. Palmer for medical help.
Oh my God!
You get me in an operating theater now, just you. Now, I haven't any time.
What happened?
Stabbed. Cardiac tamponade.
So a cardiac tamponade is an actual thing, but the ability to diagnose it without someone sort of examining you or getting an ultrasound, that's pretty mad. But you know, he's the sorcerer in training, Doctor Strange now, so I think we have to let that one slide. Cardiac tamponade is a life-threatening complication of trauma to the heart. So you've probably all heard of a tampon, so something that increases in size when it's filled with fluid, and a kind of similar thing is going on in the heart. Here is the muscle of our heart that fills up with blood and pumps it around the body. Around the heart is a tough, fibrous jacket that we call the pericardium. The fact it's tough is significant because its job is to protect the heart. However, if we get trauma that causes bleeding between the heart and this tough pericardial layer, then what will happen? Well, the blood as it builds up will be unable to stretch this pericardial layer, so it'll end up compressing the heart. And as the heart gets compressed, it won't be able to fill up with blood as much and therefore pump blood around the body. And this is how it ends up killing you.
What are you wearing?
Okay, so I know Dr. Strange said to just have Dr. Palmer in there on her own, but in this scenario, you need help. And you cannot manage something like a cardiac tamponade or anyone acutely unwell like this without an extra pair of hands. So the first thing they should do is pull the buzzer, get more help. It's difficult to watch. If any kind of Avenger asked me to just give them medical help on their own, no deal. No deal. And her assessment of Doctor Strange here is pretty ropey. She taps on his chest a bit, and we do that. So that would be to check if there's any kind of collapsed lung or any blood within the chest cavity there. But there's a set order that we should be prioritizing things. We call it the A to E assessment. And the top of the list is really to get help if anyone's unwell. We'd want to look after the patient's airway, then assess their breathing. So things like getting them on some oxygen, doing a proper chest examination, and then moving on to circulation. And that's why it's called the A to E assessment, because when we're panicked, we tend to miss stuff out, kind of like Dr. Palmer's doing here.
Chest cavity's clear.
The blood is in pericardial sac.
No, Stephen.
So he's lost consciousness here, not a good sign. We talked about the cardiac tamponade is probably getting bigger, and as it's doing that, it's compressing the heart and therefore reducing the amount of blood that can come out of the heart. So he's not maintaining a blood pressure to be able to perfuse his brain. Therefore, he's lost consciousness. So Dr. Palmer's preparing a needle here, and that's because she's going to try and insert a needle to try and get the blood out of the pericardial sac so that the heart can begin to fill properly again. The difficulty is just draining the blood out of the pericardial sac won't fix the underlying problem. The bleeding will still happen. So it comes back to our point, and still needing help. She'll still need a cardiothoracic surgeon to get in there and fix the underlying problem. She's just going to be helping the symptom of this tamponade, really. This is a classic thing that happens in medical dramas that is just for storytelling purposes, because that flat line, when we see that in a cardiac arrest, you do not use a defibrillator. Firstly, a cardiac tamponade can definitely cause a cardiac arrest, so that's realistic from that point of view. Or maybe it was the flying kick in the astral plane that did it, but I don't know too much about that. Secondly, you need a whole team of people in a cardiac arrest, so that is when your heart has functionally stopped beating, so there's no blood coming out of the heart. So the only way to get blood to the brain is we need to be pumping the heart for people with chest compressions and also breathing for them with some kind of rescue breaths as well. And thirdly, we would want to get a defibrillator strapped on the patient as quickly as possible. It will help us identify the rhythm of this cardiac arrest. Now, cardiac arrests come in 4 different rhythms, 2 of which respond to a defibrillator, 2 of which do not. This one that we see here is asystole, the flat line, which doesn't respond to defibrillation. So shocking the patient here will just make things worse. Okay, weirdly here, it looks like he's just gone back into a normal heart rhythm, yet you still hear the flat line sound. So again, with a rhythm like this, you wouldn't shock the patient. So I don't know quite what's going on. And this rubbing together to sort of spread the gel on the defibrillator, we don't do that anymore. We tend to have these adhesive pads that we just stick on the patient, and they stay there for the whole of the cardiac arrest. Well, we knew this was coming, but this is another classic thing that doesn't happen after a cardiac arrest. When your heart hasn't been beating properly due to a cardiac arrest, then your brain and all the other organs are going to be starved of oxygen and kind of bathing in their waste products. So it can take a long time for everything to come back online. So people will remain unconscious for a good while. And, you know, some people who have had brain damage will never regain consciousness. So after a cardiac arrest, everyone will go to the intensive care unit for sort of monitoring and support of any organs that need it. And also don't forget, although the heart has started beating again, the underlying problem of the bleeding from the cardiac tamponade may still be going on. So it's likely he'll still need some kind of intervention to sort that out. The next medical scene is where the Ancient One has fallen from a great height and therefore is rushed into hospital unconscious.
Oh my God.
It's not fibrillation. She has a stunned myocardium.
Neurogenic?
Yes.
So because the patient, the Ancient One, is unconscious, we would generally worry about anything wrong with the heart or anything wrong with the head. Or in this case, both. Dr. Strange has diagnosed a stunned myocardium. This is when injury to the brain causes it to send disruptive nerve signals to the heart. Dr. Palmer asked, is it neurogenic? So neuro means anything to do with the brain and nervous system, and genic means a cause. So they're basically asking, is it a cause of the head? And because he's kind of seen the fall, he's saying yes, so they kind of need to go to theatre to sort out the problem.
Nick. We need to relieve the pressure on her brain.
Any injury to the brain would worry about bleeding or swelling. The reason being is that your brain is in the skull, this fixed bony object, and therefore any bleeding or any swelling will increase the pressure within the brain and therefore can squash the brain and cause problems. Even worse than that, if the pressure increases so much, the brain can be forced out of the skull. So any serious increase in pressure within the skull would force the brain out of this hole here, the foramen magnum. This is where the spinal cord normally goes through. If the brain ends up getting forced through here, it can cut off its blood supply. We call this herniation, and it's pretty much fatal.
Go ahead, have full of it. She's still dropping.
We're losing her!
We need to increase her oxygen.
I need a crash cart!
Her pupils have dilated.
No reflexes, we're not reading any brain activity.
Okay, so we see another cardiac arrest here. It's done a bit better. We can see some chest compressions. They're asking for a crash cart and there's loads of people around. So this is how it should be done.
Increase her oxygen.
I need a crash cart!
Her pupils have dilated.
Someone says the pupils are dilated. This is a worrying sign. Basically means there's kind of no messages coming from the brain to the eyes to keep the tone in the iris. And it doesn't definitively mean someone's brain dead, but you know, we're heading in that direction.
A weirder way.
Dr. Palmer to the ER, please. Dr. Palmer to the ER. Announcements going off at the wrong time. Definitely happens, not romantic stuff, and they always seem to happen right when you're in the middle of doing something. There you have it, all the medical scenes from Doctor Strange broken down. Again, if they wanted to make it 100% accurate, I'm pretty sure they could do it. So all of these things would have been done just from a storytelling point of view, and from that point of view, the film is great. So if you enjoyed this, enjoyed my commentary, then why not subscribe to the channel? There's other reviews I've done of things like Scrubs, Grey's Anatomy, House, Cells at Work that I'm sure you'll enjoy, and there'll be many more videos to come. So until next time, I'll see you soon.